Mental health is the civil rights issue of our time.
Mental health workers have known for some time that healthcare has failed to live up to state and federal parity laws.
It's time to do something about it.
More than 3,000 Kaiser mental health clinicians,
Psychologists, social workers, marriage and family therapists, certified alcohol and drug counselors, and psychiatric nurses
have taken the first step in holding our employer accountable.
We came together and formed a union with the National Union of Healthcare Workers.
By joining the union, we gained employment security.
This allowed us to stand up to Kaiser's inappropriate and illegal practices.
By standing together and speaking with one voice,
we forced California's largest HMO
to take steps to fix the problem.
We didn't get everything we wanted, but we got a good contract.
It gave us the security to keep pressing Kaiser to improve patient care and change working conditions.
Kaiser did everything they could to deny us a contract and force us back into SEIU.
Kaiser Permanente made a pact with the SEIU to never give NUHW and these clinicians a contract. So that was year one of what turned out to be an almost 6-year battle to finally win a contract that protects them and further enables them to appropriately care for their patients.
Kaiser resisted settling a contract with us for 5 years in order to deny us a voice in patient care and working conditions.
We fought to gain that voice, and we have to make use of it.
We need you to get involved.
We need your ideas,
your energy,
your experience,
and your input to keep up the fight.
We campaigned to force Kaiser to stop breaking the law.
Nothing we have was given to us. We fought for all of it.
We achieved a lot.
We want a commitment from Kaiser to hire an additional 500 clinicians to improve access for patients.
We also wanted Kaiser to start providing timely access to good mental health care.
We won a voice in the decision-making process. We also won the right to advocate for our patients without fear of retaliation.
We won binding arbitration over disputes around discipline and termination.
We also preserve benefits for ourselves as well as for other Kaiser employees.
We also won 15% raises over 3 years and a $5,000 bonus.
The problem is that Kaiser did not staff the clinics with enough mental health clinicians to provide the timely, quality access to mental health services that it was obliged to provide.
The primary problem was access.
Patients were forced to endure long wait times for care.
Our schedules were booked up to 10 weeks in advance.
There were many other problems, such as forcing our patients into group therapy when what they needed was one-on-one therapy.
For patients suffering from depression, anxiety, and other mental illnesses, these delays were simply insurmountable.
We're trained as caregivers, but we're forced to rush patients through the system.
We as mental health professionals were really hamstrung in our ability to provide the services that we've trained to provide. And I can't begin to tell you what it's like for clinicians who come to this work as a calling and as a passion that then find themselves encumbered by a system that does not allow them to deliver the services that they know are needed.
NUHW was the only union that would help us to take on Kaiser.
These behavioral health clinicians are selfless. In my 40 years, I've not experienced a more complete and whole, total commitment to their patients.
NUHW helped us get organized.
They gave us the tools and the know-how to start changing the system.
Clinicians throughout California documented the problems in their clinics.
We compiled the documentation in a white paper called Care Delayed, Care Denied.
We proved that Kaiser had a serious problem on its hands.
The DMHC fined Kaiser $4 million for systematically understaffing its facilities. Kaiser also falsified patient records to conceal long wait times.
Kaiser fought the fine, kept breaking the law, tried to deny, dilute, move things around.
Kaiser continued to rake in huge profits by withholding the services they were legally and ethically required to provide.
We went to the press, we took out ads, and we used social media.
We partnered with the National Alliance on Mental Illness, the Courage Campaign, and families of Kaiser patients.
Our fight culminated in a one-week statewide strike in January of 2015.
Thousands of clinicians took to the streets. There were 65 picket lines in 35 locations, and the outpouring of support really catapulted the issue in the eyes of the public.
Largest mental health strike in the country in history that generated enormous press, over 1,000 press articles, not only across this country, but in Europe and in other parts of the world also, that just focused a light on Kaiser's inadequacies, around mental health care.
It worked. We forced Kaiser to start addressing the problem.
The Courage Campaign was an extremely important partner in helping us hold Kaiser accountable to provide adequate mental health care. It's an online advocacy organization with over 1 million members committed to progressive ideals, to helping change government to make it more accountable to its citizens. The Courage Campaign, for example, has an annual event where they recognize heroes that had the courage to make great change. The Courage Campaign chose the mental health care clinicians in the National Union of Healthcare Workers. And it was also very satisfying that the award was presented by Darrell Steinberg, former President Pro Tem of the California Senate, recently elected mayor of Sacramento. His life's career has been focused on mental health care and accomplishing legislation in California to provide adequate mental health care, and to get presented the award by him was very satisfying, and these clinicians deserve that great recognition.
The fight is not over.
We've made some important gains, but we need to hold Kaiser accountable.
We have the opportunity to truly reform Kaiser
and make it the model for mental health services.
By raising the standards at Kaiser, we can raise the standards throughout the industry.
We got into this line of work to help people, but the business side of healthcare sometimes makes that difficult. It's our job to hold Kaiser accountable to its patients.
NUHW is unique among unions.
It's member-driven, democratic, and willing to fight the good fight no matter what it takes.
We all need to get involved, become a steward, join our executive board, but basically work to organize workers and keep them informed about the importance of this fight.
We still have a long way to go to achieve mental health care parity at Kaiser and in the country as a whole.
But we've taken an important first step, and we're leading the way.
Join us.
Join us.
Join us.
Join us.